You look good, doctor.
Hey, thank you, sir.
Yeah,
Got
you
this
look
bow
good.
tie.
Yep,
It's in honor of my father-in-law. He taught me how to tie these things several years ago.
absolutely. You look great.
Thank you.
Okay, you're now live.
Good morning and welcome to the Hope Task Force meeting for January the 22nd, 2021. As we begin the meeting, I'd like to take care of a little business. We're doing this virtually rather than in person. So pursuant to Executive Order 2020-07, 2019 Illinois EOA 20-07, issued March 16th, 2020 during the duration of the COVID-19 gubernatorial disaster proclamation, the provisions of the Open Meetings Act 5 ILCS 120 requiring or relating to in-person attendance by members of a public body are suspended. Specifically, the conditions in 5 ILCS 120/7 limiting when remote participation is permitted are suspended. Pursuant to Section 7E of this Act, today's meeting is being conducted remotely and is being live streamed for the public's viewing. This meeting is also being recorded in compliance with the Open Meetings Act. You know, the DuPage County Health Department is the lead agency for the DuPage County in response to the global pandemic, and as such is currently closed to the public except by appointment. This is in adherence to public health guidelines and for the protection and safety of the public and staff. Welcome, everyone. Glad to see so many bright, shining faces this January day. And I'm glad you made this a priority to be with us today to do this important work. I'm going to start off with a roll call. And if I leave you out, or if the person I name, you're taking their place today, please correct that so that Penny can give us all credit for being here today. I'll start off with my co-chair, Greg Hart.
Here.
Bob Berlin.
Good morning, Lanny. Here.
Hey, it's so good to see you, Bob. Judge, was Judge Guerin, who's taking Judge Guerin's place today? Judge Athanikar, possibly? No, no one for that place today. Dr. Rich Jorgensen.
Here.
Hey, partner, we look forward to hearing from you later.
Yep.
Dr. Darlene Rossetti. Dr. Darlene Rossetti, or anyone taking her place. Sheriff Mendrick. Is there anyone from the sheriff's office today? Mike Drugan? No one from the sheriff's office, okay. Grant Eckhoff, another member from the DuPage County Board. Mr. Eckhoff?
Hey, Lanny, this is Chris. I see Mike Drugan waving.
Mike Drugan is waving. Okay, thank you. Did you catch that, Penny? Thanks, Chris.
I did.
Okay. So let's go on to Jeff York.
Here.
Hi, Jeff. Karen Ayala.
Good morning. Here.
Hey, there you are. Good. It's good to have you, Karen. Bernadine McFarland.
Good morning.
Good morning. Welcome. Greg Vesta.
I'm here. Good morning.
Hey, Greg. Welcome. Keith Creston.
Right here, G.
Hey, partner. Rich Veenstra, Mayor of Addison.
Good morning.
Hey, Rich. Good to have you with us, Mayor. Jim Scarpace. Jim Scarpace. Anyone representing Gateway today? Okay. Michelle Worobiak, I think, has had her last meeting last year. Sadly, she won't be with us. She's down in Ohio. She could have joined us from Ohio. Allison Johnson.
Here.
Hey, Allison.
Hey.
Lisa Schwach. Lisa Schwach. Brad Gerke.
Here. Good morning, everyone.
Hey, Brad. Good to see you, buddy. Deb Lewin.
Good morning, I'm here.
Thank you. Laura Crawford.
Good morning, I'm here.
Andrew Anselm.
Good morning, everybody. I'm here.
Hey, Andy. Did I leave anyone out?
Hi, Holly Brunton from Serenity House.
Oh, Holly, good. You're one of our you're one of our new members, is that right?
No, we've been involved for a while.
Okay.
Dr. Wilson, Holly's going to be presenting later as one of the
Presenting, yeah,
grantees.
but okay, but I'm just talking about
Oh,
members
no.
members of our committee right now. So we'll welcome Holly later. Greg Schwartz.
Yes, hi, I'm Greg Schwarzy, newly elected DuPage County Board in District 6.
Oh, okay, great. So you're taking Grant Eckhoff's place then, Greg?
Well, I don't know about that, but I was invited, and this is a passion of mine, so that's why I'm here.
Okay, so we haven't decided who will be in that position. Maybe Grant, maybe you. But welcome. I'm so happy you're with us today.
Yeah, Lanny, if you don't mind, I'll jump in. So we do have a number of DuPage County board members on the line today. We did extend the invite to them to participate today. So Greg, great to see you on the line. I know we have member Lynn LaPlante as well, both new board members that joined this year. So we look forward to their contributions to this issue. I do also want to recognize my colleagues Dawn Dessart and Liz Chaplin, who are also on the line. So thank you both for being here too.
Fantastic. Greg, thank you for your sensitivity to those matters. And now, with that, I will turn the meeting over to Greg.
Thanks, Lanny, and Happy New Year, everyone. I think we said this at the end of the last meeting, but definitely been a tough year in 2020. We all are certainly aware of that. And our work definitely continues, both in terms of the pandemic, but also the effect the pandemic is having on substance use disorder, which we'll hear a little bit about later. I'll pause right now just to accept the meeting minutes from the November 13th, 2020 meeting. Is there consensus around those meeting minutes, or are there any additions, corrections, or deletions that are suggested from any members of the task force? And I'll also note, if you have a question or if you want to make meeting minute changes, feel free to raise your hand using the feature in Zoom. I'll monitor the attendee list. And then if that isn't suitable, feel free to just wave in the camera and I'll do my best to see if anyone's trying to be recognized. So any changes to the minutes? Okay, seeing none, I think we can consider those accepted. So thank you for that. There's no public comment, so we'll move on to the first agenda item, which is a COVID-19 update. And I'm going to turn the floor over to our colleague, Chris Hoff from the Health Department. Chris, take it away.
Everybody, thanks, Greg. Can you hear me okay?
Yes.
Okay, I see heads nodding. Excellent. Well, yes, I'm Chris Hoff. I'm the Director of Community Health Resources at the Health Department. We wanted to provide a quick update on the COVID situation, and especially the vaccine distribution, because I know that has a lot of interest, and we're all very anxious to get vaccinated and get to the end of this horrible COVID pandemic. And it's on the way. It's extremely exciting that 1 year, last week was the 1 year anniversary of the first case in the United States. To be where we are today and to have 2 safe, effective vaccines is incredible. Now we've got a huge task in front of us in terms of how much vaccine will be able to be produced and how quickly it can get out. But just want to pause and reflect on how amazing it is that we have safe, effective vaccines so quickly. And I'm going to switch over and give you a couple of visuals. And Mila, can you confirm that you're seeing a full slide versus the presenter view?
I see the presenter view.
How about now?
Now you're good.
Okay, excellent, thanks. Okay, and we'll share these slides after the fact with everybody. This is information that we're trying to push out as far and wide as possible. So happy to provide updates here, and then ask that you help communicate this information out to your clients and stakeholders too. So first and foremost, our vaccines are a critical part of ending the pandemic and getting us out of this horrible phase that we're in. But they're one of the ways that we'll get out. And until we have enough vaccine for everybody to be immunized, we still need to wear masks. We still need to physically distance. We still need to avoid indoor gatherings with lots of people without masks. And so just a reminder that as exciting as it is to have vaccine and as thrilled as we are to be distributing it, we're not going to have enough. There's just not enough being produced to get to everybody as quickly as we'd like. So we really want to remind everyone and ask for you to help with your staff, your clients, your community members, that we need to continue to do the things that we know work, like wearing a mask, keeping our distance, avoiding these large indoor gatherings, until we have the opportunity to vaccinate everyone, and really keep that front and center. Even after you get vaccine, this is another important factor, just kind of putting the context of how quickly we need to get people vaccinated. At this point, even after you get vaccinated, we'll still need to wear masks. We'll still need to keep our physical distance, and we'll still need to potentially quarantine if we've had a close contact exposure with a confirmed case. We know the vaccines work to prevent you from getting really sick and potentially dying. What is being understood now, and we're learning more about, is how well those vaccines prevent transmission. So you may not be sick, but you may still be possible to transmit that disease. And until we know more about that, until we know more about that.
Sorry, can everyone go on mute? I think, Mr. Drugan, I think we're getting an echo from you. If everyone could just go on mute until the presentation's over, that'd be great. Thank you.
I'm trying.
Penny, are you able to?
I'm gonna go ahead and mute everyone, but Chris, you'll have to unmute yourself then, okay?
Okay.
Okay, everyone is on mute.
Okay, thanks, Penny. So just a reminder that we will still need to do these things after we've been vaccinated. We expect these to potentially be changed in the coming months, but if it's one of the things that people are worried about getting vaccinated immediately is that, well, then I don't need to wear a mask, or then I don't need to physically distance when I'm at work, or then we can go back to these big group gatherings, and that won't be the case immediately. So just important to understand that that's where we are today with vaccines. We're working to get it out as quickly as possible, but some of these things will not go away immediately as people are vaccinated. So I think an important note. In terms of, let's see, our vaccination goals for DuPage County, we're obviously focused on the adult population over 18. One of the vaccines is approved for use in 16 and up, but in general, we're focused on this 18 and up population. And that part of DuPage is about 715,000 people. And as we look at the herd immunity levels and the goal of really trying to vaccinate as many people as possible, we're aiming for at least 80% of that population being vaccinated, which means that we'll need enough vaccine to vaccinate almost 572,000 people. And at this point, with the vaccines that we have today, that would require 2 doses. So we're going to need over 1 million doses of vaccine just in DuPage County to fully vaccinate this group of people. So you can imagine the immense logistical undertaking that this requires. And the vaccine that we're going to need just here in DuPage County to do that. Right now, we're currently receiving an average of about 13,000 doses per week here in DuPage County. This is the most important fact about probably this whole presentation. The vaccine supply is the most limiting factor in how many people we can vaccinate every week. And as you can see from media stories all over the country, that there's just not enough vaccine, right? So we have 2 manufacturers that are producing vaccine. They're clearly producing vaccine as fast as they can. But we're in a position where we're not going to see a huge bump in the amount of vaccine available until they really scale up production, or until there are additional vaccines that are approved. We anticipate that there will be more vaccines coming to market, but until that they are, or this production scales up dramatically, we're really limited by the amount of vaccine that we're getting. So our goal is to push every dose of vaccine that we get out as quickly as we possibly can, which is what we've been doing since December 17th when the first shipment showed up here in DuPage. And in that time, almost 49,000 doses have been administered. Over 14,000 DuPage County residents are fully immunized with 2 doses. And that means that we have just over 1.5% of our population fully immunized. Now, that's a tiny number, but I want to recognize and celebrate the success of having those people fully vaccinated in our community 1 year after this started. So this is where we're starting. It's not where we're going to end, but these are the metrics that we'll be reporting back to the community and helping keep people up to date on where we are and where we're going. The link here, if you want to dive deeper into data about DuPage or the state, you can track the number of vaccines being administered. and watch how much vaccine is coming into the state. And our goal in DuPage is really to expand the number of sites who are receiving and administering vaccine. So if you're wondering, where am I going to get vaccinated? It could be any number of these places. So every hospital in DuPage has been vaccinating people since December 17th. We're adding more and more retail pharmacies every week who are receiving vaccine and administering. Outpatient clinics are starting to receive vaccine. So if you're a patient of some of these large medical groups, you may have been texted to say, let us know if you're interested. And as soon as we have vaccine, we'll contact you. The goal is, again, to have vaccine out in as many places as possible. Think of it like a flu shot, right? So you can get vaccinated at work. You may be vaccinated at the grocery store when you're there to pick up other stuff. You may schedule an appointment at a pharmacy. You may get it in the context of a physician or a healthcare provider visit. Again, the goal is to have as much vaccine out in these places as possible. And right now we have about 80 providers that are signed up to provide vaccine in DuPage County. And we just need to have enough vaccine to get it to them. So if you feel like, this is going too slow, why aren't we going faster? It's really limited by the vaccine we have. And at some point, the vaccine supply is finite. So we're going to be pushing to get as much vaccine out as quickly as we can, as soon as that vaccine becomes available to us. In terms of just kind of where we stand against other counties, this is a DuPage group, right? We think DuPage is the best and we want to prove it. And so we're pleased to say that as of yesterday's data, DuPage is #1 in the state for the percent of our population that's fully vaccinated. So again, that doesn't mean much if you haven't been vaccinated or you're waiting for that or you have a condition that puts you at risk. But we do want to demonstrate and build confidence in people that we are actually administering the vaccine that we have as quickly as we can. And we're doing really good. And healthcare systems, healthcare providers that have jumped into this are a huge part of that. And we want to recognize and appreciate the work that has gone on and make sure that we're moving forward, right? This isn't good enough. We're not going to stop until we've got as many people vaccinated as possible. But right now, we're doing a good job getting vaccine out. In terms of the prioritization groups, a lot of questions about, who's up when. So this is an overview of the different priority groups as they stand today. So 1A is where we've been the first 6 to 8 weeks of vaccine. This is the group we're finishing up now. That's high-risk healthcare workers, residents of long-term care facilities. In DuPage County, that's about 58,000 people. So that's a pretty big chunk of people that we've had to get through and get vaccine out. 2 new vaccines that require some really logistical hurdles to store and handle appropriately. One of these vaccines is the one that needs to be stored ultra cold and maintain that cold chain. So providers have done a really good job getting this vaccine out. And we're just about to finish up this group or get through a substantial portion that have indicated they're ready for vaccine. We anticipate moving into this 1B group starting next week. So people in this group will start to be eligible. What's important to note is this 1B group is about 268,000 people in DuPage County. That's an incredible number. And if you think about the fact that we're only getting about 13,000 doses a week, it's going to take 12 weeks or so to get through this group, assuming that vaccine supply increases even a little bit. So our most important message here is that people will be eligible. People who are in this 1B group will be eligible starting Monday. Providers will be moving into this group to provide vaccine. But in no way, shape, or form will we be able to get through this whole group in a period of 1 or 2 or 5 weeks. It's going to take some time because we're really limited by the vaccine supply that we have. And our goal, again, is to get that vaccine out as quickly as we can as soon as it's received. After 1B, we move to this 1C group that includes an even bigger swath of our population. And you start to see more people eligible for vaccine in these areas. In terms of a timeline, so we initially had projected we'd take us about 6 to 8 weeks to get through 1A. We're right on schedule for that. So we'll be starting the 1B group next week. And just again, another marker that the 1B group is about 5 times bigger than the 1A group that we took care of in the first set. So we have a large group of people that are eligible. We're going to be moving as quickly as we can based on the vaccine that's available to us. But if we assume that we're going to get a stable supply, it'll probably take about 12 weeks to get through that group based on the vaccine supply that we get every week. And then things will pick up if we see more vaccines approved, if we see production scaled up through the Biden administration's use of some of the federal tools. We expect to be able to go faster over time because we'll have more vaccine available to us. But it'll probably be summer and late summer, but by the time that we've had an opportunity to vaccinate all of our population that's interested. In terms of how we know when to move on, so obviously people are very interested to know, okay, how do we know when we're moving into 1B and when will we get to the 1C group? Because that's where I am. So what we're watching for there is that demand for appointments starts to fall off. So if we get through the 1B group and we start to see that people have been vaccinated and that group is less interested at this point now in being vaccinated, there's fewer people, that's a sign to move on. If supply increases dramatically, if we get more vaccines approved for use in the United States, or the federal government is able to scale up production with the manufacturers, that'll be another sign that we can move more quickly. And finally, that we have at least 60 to 70% of people in that group vaccinated. That's a sign that it's time to move on to the next group. So where will I get my vaccine? Where will my clients get vaccinated? Our goal, again, on the right side here is to build up as many of these providers as possible and make sure that they have vaccine. If you start on the left side, every week, the federal government is making allocations available to each of the states. So once a week, the feds tell Illinois what's available to them for the state. That number is then communicated to us by IDPH. So our planning horizon is about a week at a time to know how much vaccine we're going to have. And as soon as we have that number, we're in close contact with all of these providers to assess how much vaccine they can use over the next 7 to 10 days and make sure that it can appropriately and quickly get to those places to have them push out information about vaccine. We've had a lot of questions about, who can provide vaccine. So this gets into some technical details, but the point is that, vaccines are a medical product, they're a drug. They have to be administered in a medical setting. So you can't just call up and say, hey, I'd love 100 vaccines for my staff and I'll push them out. Providers need to be registered. It needs to be in their scope of practice to actually provide vaccine. And there are some reporting requirements because, of course, we want to know where this vaccine goes. So we can't just have vaccine disappearing out into the community with no idea that it's being administered. So there are some reporting requirements and then some stringent requirements for the storage and handling of vaccine. Having vaccine is wonderful. If it sits out for too long and isn't efficacious, we've now wasted that. So we really want providers that have the capability to appropriately store, handle, and then vaccinate people appropriately. And finally, the last bullet, probably most important, is that we have vaccine available to allocate to these providers. We're going to be in a position soon where we have more than enough sites to give vaccine. We have more than enough providers who are able, but we don't have enough vaccine to actually push out more quickly. So that really is the rate limiting step. For questions about how do we get to these recommendations, who decides who goes first, and who makes those decisions and how do they do it? We have a process nationally that's in place to allocate vaccine, especially when it's in limited supply or there needs to be recommendations about who to receive it. So one group is the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices. They do this for every vaccine that's on the market. They make specific recommendations about who needs vaccine and how many doses and how often it needs to be redone. And so they've done that for the COVID-19 vaccine. And nationally, that's where these recommendations come from. And then the states also have the ability to modify those recommendations. And Illinois has done that here for the state of Illinois. As we move into the 1B group, so 1A, remember, was healthcare workers and anybody living in a long-term care or skilled nursing facility. As we move into 1B, this is the group and some examples of people that are eligible in 1B. Again, this is 268,000 people in DuPage County, so a lot of people fit this category. And this balances both the people who are older than 65, who may be at higher risk for COVID, and then also these frontline essential workers that provide some really important functions for society to keep us fed, keep us moving, keep us safe, and have a system that's in place to provide kind of that safety net to us. A note here, just as highlight, these are some of the principles that the Federal Advisory Committee on Immunization Practice used to make these recommendations. They don't just pull them out of thin air. There's a lot of thought that goes into figuring out how do we prioritize something that's in such short supply. And we've had a lot of questions about, why are people who are older than 65 in the same bucket as young police officers or young grocery store clerks? And the idea really is that we're trying to balance both the risk to people who are at increased risk for severe outcomes related to COVID and make sure that we minimize the disruption in society from people who are out sick or who are transmitting disease to these people at risk. So we're trying to balance both of those things in this next group. Once we get through 1B, a larger group of people and many of your clients likely will fit into these buckets. Of 1C, it's people 16 to 64 with an underlying medical condition that puts them at higher risk for severe COVID-19 disease. Again, we're going to be moving into this group as quickly as we can. So the more vaccine we get, we're able to move quicker through the 1B group and then get into this group that includes these people aged 16 to 64 and other essential workers in these groups that may not be frontline essential workers, but play a critical role in society. And then phase 2 really includes everybody else that doesn't fit in one of those buckets. And both 1C, this group, and phase 2, we expect a lot more information in Illinois coming out. So it'll be a couple of months before we get into these groups. So I would fully anticipate seeing more detail to flesh out these groups becoming available. So to wrap up, current work is that over 48,000 doses have been administered as of yesterday. Our work at the health department is allocating the vaccine that's available to us every week. So again, each week we learn what's available for the next week. So we don't have the ability to project out, with a great deal of specificity how fast we're going to be able to go based on the vaccine. We know week to week. So we're in very close contact with the healthcare providers and health systems who are vaccinating. We are running clinics through the health department here, and that's a portion of everything that's going out every week. So the health department is doing clinics for about 1,500 people a week, but other providers, health systems, pharmacies, other outpatient settings are doing thousands of appointments per week. And I know that you'll see a lot more information in the coming weeks about where to access vaccine. Health systems are texting patients. Retail pharmacies are signing people up as they get vaccine. So you're going to start to see a lot more information as vaccine supply increases. But if it feels like it's just so hard to find right now, it's because there's such limited supplies. The providers aren't signing up tens or hundreds of thousands of people only to cancel them because we don't have vaccine. And finally, we are encouraging people to sign up for updates about vaccine. So we're committed to making information available to people as we have it. So there is an opportunity to sign up for information. Again, it's not signing up for a specific appointment because we don't know when we're going to have the vaccine to do that. But this at least allows us to push information directly to people about how and where vaccine is available. So please share this with staff, share this with clients, share this with the community. We've put this out. It won't be perfect, right? So there's going to be lots of providers coming online that have vaccine that will be offering signups, but this will at least allow us to push information to people and help them find vaccine as it's available. And with that, I will stop for questions. And Dr. Wilson and Greg, if you can keep an eye on time, I'm happy to take as many questions as we can get through in the time that we have, and then follow up later for anybody that we don't get a chance to answer questions for.
Thank you, Chris. And I know we have a couple questions coming through. So just at the onset, I want to thank you, Chris, and the rest of the health department for all the work that you're doing. I know this is clearly an unprecedented situation that we're dealing with, and everyone's going with the information that they have, and you guys have been handling it in a very professional manner. So we really appreciate that on behalf of the county. Before I get to the other questions, I'll take a point of personal privilege. I do just want to ask Chris about the communication plan regarding updates. So I appreciate you sharing that link at the end. I know I've received a number of questions from constituents about how they can get more information about vaccine. Is the health department planning to do anything to further communicate, signing up via that link or other information about vaccine availability beyond what we just talked about on the website?
Yeah, great question. Yes, as more vaccine is available and we have more opportunities to get people vaccinated, there'll be a lot more information coming out about how and where to sign up. I think you've seen that every provider is, and some of you, if you are vaccine providers, I see the hospitals here, there's a really fine balance between telling people to come sign up or show up or call when there isn't vaccine. So we're trying to make sure that people know where to go to get information. And this is going to take many months to get through. So we will be adding more and more communication. Hopefully you've seen us ramp that up. If you feel there's areas we need to do better or more, please let us know. We're going to be pushing out that link. That's one opportunity, our own media, and then communication with partners as well about how to register. The state too will likely, we've heard that in the coming days, will probably launch some more tools to help people find vaccine. Again, as the supply gets a little bit more predictable and more vaccine becomes available, it's easier to direct people exactly where to go. There's a fine balance between having 1 million people sign up and having 13,000 doses of vaccine actually on hand to vaccinate. So we really ask for your help in helping people understand how that works, and making sure that we're able to push updates. We need to be able to tell people where vaccine will be available and how they will sign up. So open to feedback on that.
And I have a question too, if I may. It's a little bit selfish, but hopefully since it's practical questions, maybe it'll help other people out there. I was fortunate to get my first vaccination through the health department a couple of weeks ago, and I was told that I'd be informed when I'd be getting my next dose. I signed up through www.dupagehealth.org/COVID-19 vaccine. Will I automatically be notified when I should sign up for my next dose?
Yeah, so for the health department's clinics, we are following up with people who got a first dose with us to schedule a second dose. For the thousands of people that have been vaccinated through health systems and other providers, same concept that they're scheduling as the vaccine is available and as that 3 or 4 week window passes for the second dose. So yes, you should absolutely expect more information about scheduling a second dose coming up, and anybody that has.
And the
And
second,
a couple of,
yeah, go ahead, Karen.
sorry. Just a couple of clarifications. When you register on the sign up for the vaccine registration, if you're eligible, then we're taking your information, and once clinics are opening up, meaning we know we have vaccine availability, then we're sending you a link to schedule for those appointments. I think there's a lot of people, particularly in the 1B category, that signed up on the link for information, expecting that as soon as they signed up, they would get a scheduling appointment. Of course, one issue is they're not eligible until Monday, the 25th. And the second very important point is, we're not, to just reinforce what Chris mentioned, we're not going to schedule people for clinics unless we know we have vaccine. So I think those are very important. And the second, if I just could quickly mention, is the vaccine is the same wherever you get it. So we're encouraging people, if they're getting messages from their primary care doctor, if they're getting messages from their pharmacy of choice, please get the vaccine as soon as you possibly can from whomever you are able to. It's not better or worse to get it from one provider over another. Thank you, and sorry to interrupt, Dr. Wilson.
No, you didn't at all. In fact, you kind of answered my second question, because my second question was with regard to that 1B category, which my wife is. So I'm selfishly want her to get her vaccine, so we're together. So I know that the state of Illinois is recommending that stage 1Bs begin on Monday, and you've said that DuPage County is going to be following suit. So she's signed up through that same website. So when the vaccine is available, she will be informed. Is that correct? She will be informed when she can sign up.
Yes, I'll take that, Lanny. Yes, so anybody signed up on 1B, we're going to be pushing information to everybody. Again, we've had almost, I got to check the numbers, we've had tens of thousands of people sign up for that. So we're pushing information as we have vaccine and as we have availability. So anybody that did sign up will absolutely get communication from us as more vaccine is available.
Thank you, Chris. And then finally, on that same point, is it first come, first serve? So if you were number one to sign up, you'll be the first person to hear, or something like that?
For 1B, we'll be pushing information to people in that group. But again, we're going to have vaccine at many different providers. So it's not necessarily that people that signed up first on our list will get a vaccine at Walgreens or at Jewel. So there's going to be lots of opportunities for people to get vaccine. We're going to try to follow that, as best we can. But again, since you're not signing up for a specific appointment or slot, there may be other places that you'll get vaccinated.
Thank you. I hope that helped others.
Go ahead, Lanny. Sorry about that.
No, that was good. It was selfish, but I hope that they were the kind of things that would help others as well. Thank you.
Definitely. So I see we have two other questions on the chat. First from County Board Member Liz Chaplin, and then after that, I'll recognize County Board Member Dawn to start. So Liz, feel free to go ahead.
Thank you. Thank you so much, Greg. I want to thank Chris. Chris, this is just a great presentation, full of a lot of really good and useful information. So my question is kind of selfish too. I would really love to see this presentation come before the county board. Maybe Karen, maybe you can arrange to get on the agenda for our first February meeting, because, we are getting a lot of calls and inquiries about the vaccination rollout. And I think, when people hear this, about that we're only getting the 13,000 doses a week, we can only do what we can do, and that we're really trying to get people vaccinated, but we can, like I said, we can only do what we can do. So I think it's a great presentation. And I was wondering if you'd be able to provide the PowerPoint to us, if that would be possible, and that we could possibly share that as well. I don't know if that's a possibility.
You have to
Muted.
unmute, Chris.
Thanks. Still a year, haven't quite gotten it. Yes, we'll definitely share the information with you, the slides. You're welcome to share those. I put the most recent media release in the chat that we just put out yesterday that has some of these details if you want to use that in your communication. And if Karen is on, I believe Karen is, will be giving an update to the county board next Tuesday.
Oh, great. Great. Thank you so much. Appreciate it.
Thank you, Liz. Member Dessart, do you want to go next? Dawn, do you still have a question? Dawn Dessart?
I do. Thank you, Greg. Chris, first of all, thank you so much. That was an excellent presentation. I have two quick questions. One is, why is DuPage County only receiving 13,000 vaccines a week? Is the distribution based on population, or how is that based?
That's a great question. And the short answer is we don't know. The long answer is that we've been working with the state to be able to share more information about how they're allocating the vaccine that they receive. So if the state receives, 100 doses, some of that goes to the long-term care facilities for the pharmacy programs that are vaccinating those individuals. Some of it is going directly to counties to distribute them to their healthcare providers. We understand that some of that vaccine will be going to retail pharmacies directly. That is a question we have. We want to be able to better answer because our number has fluctuated. So it's an average of 13,000, but it's kind of gone up and down. And so planning for, how many appointments do we need next week for our health systems that are trying to schedule individuals? How many should they plan for? We're kind of at the mercy of the vaccine supply that we do get. We understand that it's a limited number. We're not going to exponentially increase the amount of vaccine we have, but we'd love to have a little bit more detail to share about how exactly those decisions are being made.
And follow up on that question before I get to my second question is, so do these other institutions, these other retail places, for example, Jewel or Osco or CVS, do they still have to follow the guidelines of the 1A group getting the vaccines first, the 1B second, or can they get them to any of their customers?
They need to follow the prioritization that we're in. And you're seeing a little bit of overlap this week and next week as the transition to 1B happens. So like, for example, we'll continue to vaccinate 1A healthcare workers that haven't had an opportunity. You may start to see retail pharmacies do 1B, but in general, they should be in the same block that everybody is in so that people are being vaccinated kind of at the same phase.
Thank you. My second question is a quick question. You either know it or don't. Is the health department privy to, I know that there's a huge push for schools to reopen. Are there any trials going on right now regarding vaccinations and children, that 16 and under group?
They are going on. I don't personally have a lot of detail. I know the manufacturers are interested in that and conducting trials to evaluate how well the vaccines work in kids. I think it'll probably be late summer, early fall before we have anything that tells us how well they work. But that's kind of a guess just based on what we've seen about the status of those trials.
Thank you, Chris. Thank you, Member Hart.
Thank you, Member Dessart. So I know we're coming up to time on this agenda item, but I know this is a topic of interest, so I'll extend it for a couple more minutes. I know we have a chat question from Allison Johnson, our member from Central DuPage Hospital, and her question is, does the recipient need to prove they're in the category? How does the county know who is in each category?
It's a great question. So for healthcare workers, for example, we were asking people to bring an ID, a copy of their medical license, a paycheck stub, something that shows that they're in healthcare. We'll probably have a similar process in 1B for some of these essential workers, the frontline essential workers. And the state has said they're working on I can't remember the word, a statement or like an affidavit that says, you are in this group and you are acknowledging that you fit this criteria. It will be a challenge, honestly, with the number of people that are eligible. And so I think the best we can do is really help people understand why some groups are prioritized. And, if you have the opportunity, we want to make sure those at the front line that have been serving us for the past year in this horrible pandemic have a chance to be vaccinated. And that's why they're up first. But we'll have something similar where we ask people to prove to some level that they are part of that 1B group. It's a great question.
I hope you have some security present when you're screening people, Chris. It might be a good idea. There's some, yeah.
Yeah, it's a challenge,
But-
right? I mean, people are
yeah.
all anxious to get vaccinated. We want our family members to be vaccinated. We want our clients to be vaccinated. And there's a lot of interest and not a lot of supply. So yeah, we're trying to provide people as much information on the front end about if they're eligible or not. And if they do show up, help them understand, why these things are in place. So anything you can do to help build confidence, and, we will have enough vaccine for everybody at some point. And if people are up first and you're not, it's for a good reason. It doesn't feel good, but we need help helping people understand.
Okay. Thank you.
Thank you, Allison. I don't see any other hands raised in the Zoom tool. Are there any other questions for Chris? I don't see any. Chris, one last question from my standpoint. I know President Biden has made a point of saying that he's going to release nearly all available vaccine doses in the federal supply. I don't know what that does to our supply. One would think that it would trickle down to some extent. But has there been any guidance given from the state or the federal government to DuPage about how that may impact our supply coming forward?
No, and to be honest, with this group, again, it's really not clear how much vaccine is in the pipeline and where. So we heard that same thing, that second doses would be released immediately. And then, the outgoing administration said, well, we already did that. So we are trying to get some clarity about, what vaccine is available, how much could be available in the coming weeks. That's definitely an area of interest for us, as it is for everybody to know, just how much vaccine is out there. And I hope that we'll see a little bit more in the next week or two. Some really good people that are joining the COVID response teams. And I think we'll see a little bit more about that. And we'll definitely share that with you all as we get it.
Great, thank you. Okay, last opportunity. Any other questions on the COVID-19 update?
Greg, I don't have a question. I just have a comment from Mike Drugan from the Sheriff's Office. He just wanted to share with Karen and Chris that the sheriff has offered to send nursing staff over to assist with vaccine administration. If there's an opportunity to do that, just get in touch with Mike and he can help coordinate if we have enough supply to add his staff to those administering. Thank you.
Thanks, Mike.
Thanks. Thank you very much. Okay, unless there's anything else, we'll move on to the second item on our agenda, which is the DuPage County 2020 opioid death data. I know this is also sadly an issue that a lot of us have an interest in, obviously a stake in. Dr. Jorgensen is on the line, our coroner, and Doctor, I'm going to turn it over to you to walk us through the metrics from last year.
Okay, thank you. And I throw out that the health department has done an amazing job of handling all of these issues related to the COVID crisis, and I would like to compliment them and thank them and appreciate how difficult and how hard their work was. But I don't have anything good to talk about. I put out a public service announcement after 6 months of our time, and that showed that was about half of the time in 2020 was in our lockdown, and about half of it was prior to the lockdown, and that showed that there was a 52% increase in the number of overdose deaths, and that at that time we had 70 overdose deaths, which was a staggering number. The only good thing I can tell you is that it dropped down somewhat, but we had 96 overdose deaths in 2019, and these are preliminary statistics. We have not completed all of our cases, but currently we're at 126 deaths, which is a 31% increase from the year before. In the previous year, I reported that the number of females and males has stayed about the same. There's about 75% of males, and the age range in 2019 and 2018 had been moving into an older age range, with 30 being the highest number of deaths. In the current year, or 2020, it returned back to predominantly 20s and 30s, and that we had 18 20-year-olds and 17 30-year-olds. But good news, we had no teens. So it seemed to be that it moved a little bit more back into the 20s and 30s, whereas in 2018 and 2019 it had moved a little bit higher age range. But there's nothing good to talk about. Our overdose deaths are still through the roof. They're the highest they've ever been and continue to be so. Any questions or comments?
Rich, I have a question. I know the pandemic is raging, and of course that has its own depression and exclusion problems. But in that death rate, were any of those possibly caused by the COVID virus?
No.
Okay.
It was caused by the COVID virus indirectly.
Sure.
I can tell you also in this information review that I did, I've also reviewed all of the suicides that occurred in our county. They continue to be up at least 20 some percent. And I can tell you that virtually every person that has died of either suicide or overdose, in reviewing their history, every one of them had a similar history of about 6 or 7 points, and those were that they had mental health problems, they had history of depression, they had personal, professional, or financial problems, marital problems, and or addictive problems, and almost every one of them lived alone or were getting divorced or had those kind of problems. So these are the vulnerable people in our society, and there's no question that this COVID pandemic and the shelter in place has affected this community of people.
Okay. Good answer. Thank you so much, Dr. Jorgensen.
Yeah.
Yeah, Doctor, thank you for your update. Obviously, it's terrible news. We're an action-oriented task force. I know during the pandemic, we've done all we can to continue to invest in new programs to help connect people to treatment. We've expanded the Narcan program. I hesitate to ask this question because I don't know if there's a good answer, but given that the data that we're seeing here in many cases mirrors what's happening throughout the country, to your point, that certainly links it to the pandemic. What more do you think we in DuPage can be doing? And I guess I'll open up this question to any other member of the task force as well if you have ideas. But obviously we can't impact the shelter in place. What more from a policy standpoint or resources standpoint do you think we can be doing to help address some of these numbers? Because as was noted, the pandemic, we're making great strides, but we're likely going to have residual effects from it, throughout 2021. So just kind of an open-ended question for you.
Yeah, I think the easy answer, which is a hard answer, is that we need to get back to normal life. That's not quite possible. We know that, but certainly the thing, as I said in my press release, that if you know people that have any of those factors that I pointed out, we certainly can go see people. We can wear masks. We can be careful about what we do. I have this heartbreaking scenario that occurs every day outside of my office, where a father and mother have a daughter who is in the convalescent center because she was in a motor vehicle accident and she's permanently disabled. They every single day come over and sit outside of her room in parkas and mittens to meet with her. And every single day they do this, and every single day we see them and bring them coffee and try to but those kind of things are the probably the only thing we can do. But we need to get back to real life. We need to get back to society and seeing people, and all of the rehabilitation methodologies that are positive, that work, that we have, are based on society. And I've talked to, I know Brad Gerke's on this call, and I've talked to Jim Scarpace and other people, but all of our modalities that are successful are societal. You have to go to meetings, you have to meet with people, you have to talk to people, you have to be with people, and that's totally taken away from all of the people that are in rehabilitation or are struggling with addiction. And so the easy answer is we have to get back to normal, and the hard answer is, how do we get back to normal?
Yeah, and the only thing I would add is and this has been said many times before in this task force, this is a disease of isolation. And, we have seen sicker and sicker clients come into treatment than ever before during this time. With the substance use disorder issues they're struggling with being substantially worse than we've seen in the past, and compounded with not only other substance use disorders, but trauma, PTSD related issues as a result of the emotional isolation they've experienced during this time. And, really the difference between accessing treatment or not accessing treatment is a phone call sometimes from a family member or someone checking in on that person. So yeah, we're limited on what we can do, but we need to do something. I mean, really, if I manage DuPage County or any county in the state, I would have at every doctor's office a reminder for every family member or any person who comes in, hey, do you have someone who may be struggling with substance use disorder? Check in on them, give them a call. We have an alumni coordinator here at Gateway that does that. She reaches out to all the clients that have been through our treatment center within the last year and checks in on them multiple times in the year. And sometimes that call results in, hey, yeah, I'm struggling, I need to get back into treatment. And every one of those calls potentially saves a life. The problem is, during this time, there's less contact than ever, and we need to do more to remind people how important it is to make those calls or to have that contact.
Thank you, Jim. I see we have a question from our state's attorney, Bob Berlin. Mr. State's Attorney, feel free to proceed.
Thank you, Greg. I just wanted to give actually some what I think is good news on the courthouse side. That is, we have 61 current cases in our drug court right now, and another 52 cases that are pending contract. So hopefully within a matter of a few weeks, we'll have over 100 cases pending. These are defendants who typically have between 2 and 6 cases pending in the system. In almost all of those cases, they would be going to the penitentiary but for drug court. So it is good news because we have great results from that drug court, an 8% recidivism rate compared to over 30% when they go to the penitentiary. The other thing I wanted to update everyone on is we have over 1,000 cases now in our focus courtroom, including 610 post-disposition cases and 403 pending predispo cases. Cocaine, heroin, and fentanyl are still the predominant drug that we're seeing. And unfortunately, we're seeing a lot more MDMA cases, which is ecstasy or Molly. But it's good news that we're getting more of these offenders into treatment because it's proven that it works.
Thank you very much, Bob, for that update. That's really helpful information. Go ahead.
I'm sorry, I did not, Bob just reminded me of something that I did not discuss, and that is actually what he said about what drugs have been found. So since 2015, I've reported to you guys that the fentanyl cases have gone through the roof to the point where the major opioid in our society now is fentanyl derivatives. We had only 4 cases last year where people died of only heroin in their system. So it's all being done. And the other thing I've reported that's continued is that it's polypharmacy. We would typically have 10 or 15 different drugs of all different kinds in our toxicologies, and that continues. But as Bob just pointed out, we've had a marked increase in the amount of cocaine and methamphetamine, which we rarely had in the past. So we had a number of methamphetamine cases, but we've been having heroin, fentanyl, and cocaine in there. And as I've reported in the past as well, almost everybody's got marijuana in their system. And so there's just this huge polypharmacy of drugs with an increase in, as Bob said, MDMA and methamphetamine in the system. So just, I forgot to mention that. So I'm sorry.
Thank you, Dr.
Thanks,
Jorgensen.
Dr. Jorgensen. This is Karen again, and
Yeah.
Actually your point is cogent to the one that I would now like to make and ask and articulate, in that not only was the start of the pandemic and the subsequent stay-at-home order one of the cultural factors this past year, but I'd also like to remind us that the legalization of marijuana was also instituted January 1st. And certainly I've been following, not as closely as I'd like because of the COVID pandemic, but the record sales that have occurred through marijuana, now legal marijuana dispensaries, as well as the online alcohol deliveries, sales of alcohol across the country. And so I think that in connection with what you've said about, methamphetamines and some of these other drugs now taking hold is, we've been dealing with a heroin crisis, but really this is the use of substances across the board that we need to be addressing, and not simply heroin. Thank you.
I agree. I absolutely agree.
Yeah, no, Karen, I completely agree as well. And that's, one of the things that we're trying to wrap our head around as a task force. I know our mission is related to the heroin epidemic, but really it is a broader substance use disorder crisis that we're facing, since it's all interrelated. So thank you for mentioning that. I am cognizant of the fact that we only have 30 minutes left in the meeting and we have 3 topics to get to. I do know Andy Anselm has been wanting to chime in. So Andy, I'll turn it over to you. And then I think we may take one more question, then we'll have to move on to the next topic. But go ahead, Andy.
Good morning, everybody. Some of this State's Attorney Berlin and Coroner Jorgensen already hit on, but some of the things that we're seeing at DUMEG, last month we seized 10 kilos of fentanyl, which is more than we've seized ever. And that was just last month. We also seized a kilo of an analog for fentanyl, which we're starting to see more and more analogs. Since it's been banned in China, the production of fentanyl, they're starting to produce analogs to try to stay ahead of us. And we did seize in Lamont a kilo of an analog of fentanyl in a pill press. That pill press, they had mints for Xanax, hydrocodone, oxycodone, and other prescription pills. And from just talking to arrestees and informants, it seems like the gangs are starting to press prescription pills more and more with fentanyl, and then young kids don't see that the prescription pills is a threat as using heroin or fentanyl. So I think that's also something that we have to worry about, is these high school age and 20 age young adults using what they think is prescription pills. And a lot of times now they're being pressed here with fentanyl or analogs of fentanyl. We are also seeing more and more meth, which Dr. Jorgensen and State's Attorney Berlin hit on. I think that is here to stay from talking to other narcotics task forces throughout the state. Once meth came into their area, started to increase and hasn't left. And I think we're actually behind as far as how much meth is here compared to Will County or out west in Rockford or the Quad Cities. They're getting hit really hard with it. So I think that's something we have to be prepared for and worried about besides the opioids.
Andy. Last comment and question, I'll give it to Allison Johnson, then we'll have to move on. Allison, feel free to go ahead.
Yeah, thank you. I just wanted to ask particularly Brad and Jim. Oops, sorry. Yeah, we've been noticing a drop in demand, not for the detox and residential levels of care, but definitely a drop in demand from opioid users during the pandemic. And yet we know that the deaths are higher. So I'm curious about your thoughts on that. And then the other thing is day hospital treatment has really dropped the demand for that in our substance abuse area. Of course, our mental health areas are skyrocketing and most of our demand looks like to be there. But I'm wondering, any ideas on why, you know, people with substance abuse problems aren't seeking treatment? Do you think it's that people aren't calling them out because they're not living with them, seeing them? You know, who knows? Just wondering what your thoughts are.
Yeah, I think as said before, the isolation aspect is a huge factor. And people that are isolating, they may not be checked on as much. But for somebody in active addiction, if you give them almost I'm just trying to put my mind on where it would be if I was in that situation, the excuse to isolate, my addiction is going to run rapid. I'm going to lose. If I wasn't already off the rails, I've completely flown off when almost given the green light to isolate. So hopefully what we see from this is people start to reach a quicker bottom if they don't pass away in the process. If things become tougher, harder, at that point, people are more willing to raise their hand for help. When things are great, grand, and wonderful, you're not going to seek changing your way of life or wanting help. So I guess I'm trying to find a positive with this whole shelter in place, the devastation went with the coronavirus. If there is a positive, hopefully here in the near future, with people maybe hitting a quicker bottom, that'll get them to a quicker recovery, quicker needing to want to, seek help.
Thank you.
Yeah, I wouldn't add any more to that. I mean, I think that it's just people are disconnected more so than ever. And they're not being seen, and the disease already puts them in isolation, as Brad said, and this pandemic gives a bigger reason for that to happen more often. And then overdoses and people unfortunately are dying at a higher rate too from this illness, as we're hearing. Last night I heard from Delnor that they had 3 overdoses just in one night from a fentanyl related concoction of opiates. So unfortunately the substances people are getting are more deadly than ever as well.
Thank you everyone for your comments, and Dr. Jorgensen, thank you again for sharing those up. We'll continue to keep that our driving piece of information as we think about ways to address this problem over the next year. I did make mention to the fact that we've invested in a number of different programs, and that's what we're going to move on to next, which is an update from our grantees on their projects. I know we have updates from DuPage Probation, Path to Recovery, Serenity, the Health Department MAT treatment update. So I think I'll first turn it over to Tim McGavin to talk through probation, if that makes sense.
Good morning. Thank you. Thank you for having me. And I want to thank the HOPE Task Force for providing these funds to us to engage in the proposal that we submitted to the group. As Dr. Jorgensen said, we know that anecdotally our number of overdoses has also increased in the past year or 2 years. We are currently working on collecting that data and formalizing it. But we do know that just from discussions with probation officers that our numbers have definitely risen. We also feel fortunate in one regard that we are partners with a great group of agencies and stakeholders that help us in this process, from the judiciary to the state's attorney's office to the public defender, our treatment providers. We have a number of resources and abilities for us to combat this problem. From a probation aspect, we also have a number of different programs and services that we provide. Bob mentioned drug court, focus. We have adult redeploy, we have task, we have general high-risk cases. We have a lot of heroin and opiate users on our caseload right now, and some of them are hidden. Some of them we don't know about until months into their term. But we do know that we have a lot of people who are currently using, and it's scary to us, of course. That being said, we also recognize that we have an opportunity here. And in our proposal, what we did was this: we run our own drug testing, so we have access to immediate data when people do test positive. So we went back and we ran a report to show everybody on probation who tested positive at least one time for an opiate and I went back to September of 2019 just to kind of get before the pandemic. So we have this huge list of people, and we're starting to filter that list now and starting to kind of narrow it down. And a lot of the filters that we've applied are the ones that Dr. Jorgensen and Brad and Jim and others have touched on. So we had about 260, 270 people total on this list. Now we're starting to narrow it down, and our proposal calls for us to identify 40 of the highest risk to overdose clients that we currently have on probation. And to do that, we're looking at those people who have a history of recent opiate use. Of course, that's our first filter, but the real emphasis is given to the fentanyl user. We know anecdotally from discussing with our probationers that a majority of them who test positive for fentanyl have no idea they've used fentanyl. And I think people have touched on that already with the pill presses and things being added into different substances. So they have no idea they're using fentanyl and are sometimes seem to be genuinely shocked when we tell them that they tested positive for fentanyl. So fentanyl is our first one. We're also filtering through for those who've had a history of overdoses, non-fatal overdoses. We're looking at those who have recently been released or discharged from a custodial setting who haven't had access to substances in a while and are now out in the community and re-engaging in that behavior. One of the big ones we're looking at, and this has been mentioned several times, is this people who tend to be self-isolative. People who, from our probation officers, know that tend to isolate themselves, don't have strong social connections, don't have strong family support, don't have strong positive peer support. We're looking at those who've recently relapsed after a sustained period of sobriety, believing those folks may be at higher risk to accidentally overdose. And then, as Dr. Jorgensen mentioned, we're really also focusing on those who have a history of polysubstance abuse. When we ran this report, we saw a number of people who are mixing coke in the same urine sample, are mixing cocaine, amphetamines, heroin, fentanyl, marijuana. It's somewhat shocking. So those are the ones that we're looking at. And as a matter of fact, at 11 o'clock this morning, I have a meeting, and I timed it for after this one, with about 15 or so probation officers throughout the various programs that have been discussed to start filtering these. I've provided them the names. I've given them the names of the clients that they currently have that were on this list of 260, and we're going to start filtering it down to those 40. Once we've identified those 40, the gist of our proposal was to then match them up with recovery coaches in the community. One of the strong tenets of probation that we're working on, one of the evidence-based practices, is engaging clients in their natural communities, where they live, where they go to school, where they work, where they hang out, who they hang out with, where their family structure is. And while probation is in a great opportunity to assist that person, there is a gap, and that gap is that we don't live with them. We don't live next door to them. We don't have them on a day-to-day basis where we can guide them through some of these specific issues that have been raised in this meeting today. So we are in the process of identifying recovery coaches to help with that. We feel that if we can identify our 40 highest risk people to overdose and support them with a recovery coach and treatment providers and a probation officer, that we will have a higher likelihood of seeing those people survive this episode, this pandemic, and this opioid crisis. The recovery coaches would focus in on things that aren't always easy for a probation officer to bridge. Familial relationships, peer relationships, assisting in finding treatment and engaging with treatment, so identifying relapse triggers and sobriety challenges, helping them with employment, helping them navigate health systems, things of that nature. Probation officers do that all the time, but we need more. We need somebody else in a more neutral position. Sometimes it's difficult for a probation officer because they are seen, and they are an arm of the court. We work directly for the courts. So sometimes it's nice to have a neutral person in the community who can assist us in guiding these folks through the process. That is the proposal that we came up with. We are meeting, like I said, I have a meeting at 11 with many probation officers who are very interested, very excited about this process, because they know through their dedication, their compassion of working with people, that they also need help. They need another conduit for somebody in the community who can help direct these people towards better behaviors and making better decisions. We've also had discussions with Deb and the folks at PATH, because we have some similarities in our proposals, and looking forward to that partnership as well. So that's our goal, is to provide recovery coaches for up to 40 people. The COVID crisis is impacting. I don't think it's going to hurt. I don't think the COVID's going to impact us per se in identifying these people. I mean, we know who they are. We just need to filter them down. It's certainly going to impact the ability, at least in the first several months, I would imagine, for the recovery coach to do some of the things that they would have done prior to the pandemic, in terms of meeting face-to-face with people, getting out with them in treatment agencies, attending court with them, things of that nature. But in the long run, I think we will be able to overcome that and work. Our probation officers are really excited about this. We'll work with the recovery coach and create an atmosphere where we believe we can help these 40 individuals to not overdose.
Well, thank you so much, Tim, for the update. And, on behalf of the task force, we're really looking forward to working with you and partnering with you on this program. It's definitely needed. So thank you for the update, and we look forward to hearing more updates in the coming months.
Thank you.
I'll ask everyone just hold their questions until the end. I know we got a couple minutes left. Want to get through all the content. So we'll hit everyone on the round table. But next up for an update is Path to Recovery, and I'll turn it over to Laura McLaughlin.
Thank you so much. Is there a way to share my screen? We have like a little PowerPoint so you can see. Do I have access to do that?
It should say at the bottom, share screen.
Yep.
If not,
Okay.
Penny, do you mind giving her rights?
I think I can.
Perfect.
Okay, can you see? Oh,
Yep.
That's not it. Hello. There we go. All right. Let me get to presenter mode. Sorry. Oh. Okay, thank you so much for having us. We're super excited about this opportunity with the DuPage County Hope Task Force. And just on behalf of all of us, we're just very excited. I know Deb has been a part of this, and we're just grateful to be in the conversation. So I just wanted to go over what our mission is and what our vision is for this particular program. Our mission, as stated, is we're just committed to supporting, educating, and promoting recovery for individuals and families who are struggling with substance use disorders. And our vision is to help people live a fulfilling life free from addiction. So this program will absolutely help us do that. So our program is going to be establishing the first recovery community organization in DuPage County, which we're extremely excited about. Recovery community organizations have really flourished in other states, and we're really excited to be the first here in DuPage County. So our mission is with this particular program is to fill a vacant need in our communities for support for those either seeking recovery or already in recovery. Just because someone has long-term recovery doesn't mean that they don't need support at some point in their recovery. So we're there for anyone in all facets of the process of addiction. So, and then the second part of it is where we kind of differ from other recovery community organizations. We will still be having the family as a big, huge part of our program. So, which is Deb's original mission, was really to support our families who have children, loved ones, anyone who's struggling. So that's where we are super excited to kind of fill both sides of the issue. So these are the services that are already currently in motion with this program. So currently we have family support meetings virtually, everything's virtual right now. These are in motion. So we have meetings on Wednesday nights via Zoom. We are the first Young People in Recovery, all recovery meeting chapter in Illinois. So we're super excited for that. Those are Thursdays at 7 p.m. and all recovery meetings mean that it can be any type of recovery. So it can be anything from substance use to eating disorders or anything. It's really focusing on all recovery and not just one pathway. So we also have grief support for those who may have lost someone or anything that they need grief-wise. We are beginning a Running for Recovery group starting in the spring. It's still a little too cold for that. I don't like running in the winter. So we have a great person who's going to be a recovery coach who will actually set up those running groups. And the goal with those is to allow for either running or walking, and then afterward having either coffee or something where we have support after the physical education or the physical aspect of recovery. We have people that will help with public benefit sign up. We are currently working on a relapse prevention program. We are working on a Recovery Discovery 101 class, which will include all types of recovery. So we really want to explain to people that there's multiple pathways to recovery. And within that, it will include things from AA, NA, HA, all of the A's. We love the A's. And then everything to She Recovers, Dharma Recovery, Racing for Recovery, Adventure Recovery, Climb for Recovery. There's so many different types out there that I think people really could be exposed to and maybe find their passion for recovery. So we're really focused on finding people's passion in recovery. So at the end of February, we will have 10 trained recovery coaches, and at PATH, we will be using the CCAR model, which is the Connecticut Community for Addiction Recovery, which is sort of a gold standard in recovery coaching model. So they are national and actually working with NADAC to become a national platform for recovery coaching. I personally am a trainer through them, so I can train recovery coaches, and I can also train recovery coaches for emergency rooms. So we have those two things available, and you'll see what we plan to do with that too. But at the end of February, we will have 10 recovery coaches trained. We have a referral network started, and we're excited to partner with all of you on this call. We have employment assistance. We've already collaborated with the Career Community or the Career Networking Center in Naperville and WorkNet DuPage to bring in resume writing, interview skills, those kinds of things that as someone in early recovery, we may not know how to do those things. So how can we support people to get into the workforce? These are all our future services. I'll wait a minute. These are all the things that we want to do with this awesome opportunity from Hope Task Force. We're working on all of them. So hopefully we want to, do gardening and social. And again, this is all dependent on when we can get back to seeing people in person. So community service options, really just thinking of how we can support a whole person. So these are the next steps that we hope to have completed by March 31st. Space procurement, I actually have a meeting at 12:45 today to finish negotiations on a lease. The space, 90% sure, will be over where West Suburban Fellowship Club actually is. It'll be in that same exact building. My personal office is already there, so I'm actually just moving my personal office, and PATH will be joining me. So we will have a space there. So it's actually really exciting. We will have a great community room and places for people to meet and hold classes and all of that. So that's at 710 East Ogden in Naperville. And it is on a bus line. There's a bus stop right in front. So that will be great. We have a marketing plan going, recovery coaches training for the opportunities for the public. That's the next thing that we want to get planned so other people can become recovery coaches. And again, Tim, we've already chatted with about helping and all that good stuff. So, and then just talking with the AA club that's already established in the building that we will be in, and then offering how to get NA, HA, et cetera, maybe into our space. So, and hopefully, Brad, we can maybe have a chat offline. So about that. Yeah, great. And that is it for our presentation. I just want to say, like, from the bottom of my heart, I'm a person in long-term recovery myself. This has been a dream of mine. I'm going to cry, but I just absolutely appreciate this opportunity and for us to be able to help families and people like me. So thank you.
Well, thank you, Lauren. We feel the same way. We're really excited about this partnership, and thank you for being willing to partner with us and drive such an impact in the community. We're really excited about it. So thanks a lot. So we'll move on to the next project update, sorry, which is Serenity House. And I believe Holly from Serenity House is line.
Hi, thanks so much. I'm Holly Breton. I'm a counselor and a grant writer at Serenity House. I'll talk a little bit about Serenity House and the programs that we've had and how we contribute to the community. And then, of course, talk about what we're so excited and grateful for Hope Task Force to have the funding for our opioid medication assisted treatment harm reduction program. And the great stuff that we're doing with recovery coaching, as well as harm reduction treatment. So quickly, Serenity House Counseling Services is a nonprofit, community-based, comprehensive treatment facility. And of course, we offer services to those recovering from substance use and co-occurring disorders. We were founded in 1985. Not only does Serenity House have 107 residential beds, that's 107. We also have outpatient, adolescent outpatient, and risk ed, which of course, those outpatient services are being done online at the moment. We provide 29,000 overnights, 1,200 hours of assessments, 6,000 hours of education, and 2,500 hours of recovery coaching, which of course will be increasing this year. We prioritize the needs of individuals who are, individuals from DuPage County who are homeless or at risk of homelessness, often without resources and often referred by the criminal justice system, and they're really in need of critical services. We meet their most basic needs first. What do they need for housing, nutrition, safety, clothing, all that kind of stuff. And then we move into pairing them up with the recovery coach to ensure that they are able to work on those pre-employment skills like, resume writing, interviewing skills, managing difficult conversations regarding gaps of employment. We also help clients in getting insurance. Often they come without insurance, sometimes without identification, and then move on to the more clinical stuff with helping them with group counseling, individual counseling, and then certainly assisting them in getting to and meeting their medical and psychiatric needs. One of the innovative programs, that Serenity House has had to approach this growing epidemic of opioid epidemic, as well as the mental health crises and the COVID pandemic, was to develop the innovative approach of implementing the evidence-based treatment, medication-assisted treatment. And Serenity House now provides services for clients who are prescribed Vivitrol, naloxone, buprenorphine, Suboxone. And so in the men's halfway house, we actually have 4 rooms that are dedicated specifically to clients who are enrolled in our medication-assisted treatment, as well as 1 room in the women's halfway house. So that's about close to 20 clients at a time that we can assist with that. The goal, of course, is harm reduction. You know, we want to prevent those negative consequences that continue to stack up. We want to help improve their overall health and, of course, mitigate overdose deaths. One of the other things that we have been able to implement is called moral recognition therapy. It's a cognitive behavioral treatment that leads to enhanced moral reasoning, better decision making, more positive outcome behavior. We have several MRT trained facilitators who are clinical professionals. They facilitate the weekly groups. They utilize MRT workbook exercises and homework. And one of the cool things is that a lot of drug courts recommend MRT as its preferred evidence-based treatment. And so we have 2 individuals already trained and 2 that are also going to complete that certification. Let's see. Of course, with the medication-assisted treatment, the objectives are emphasizing how to deal with the behaviors, urges, triggers, dealing with feelings of emotions in recovery, obtaining employment, building a better sober network, complying with their medication regimens. And of course, all clients who come to Serenity House are, you know, initially given a full clinical assessment that includes their medical history, their substance use history, and then also will do drug screening upon entry and then randomly throughout the program. Our goal is to serve 120 clients, approximately 80 men, 40 women. We're certainly shooting for higher than that and have applied for funding that's looking pretty good, so that we'll be able to provide more assistance with that. And then the one cool thing is that we've developed a relationship with several healthcare facilities, including Hamdard Health, Access to Page, Family Guidance Center, the Lighthouse Recovery, and those teams pair up with Serenity House to ensure that individuals are able to continue to get their medication, continue to get their Vivitrol shots. The recovery coaching program is something that we really started putting a lot of effort into when COVID came. So individuals who were unemployed work directly with a recovery coach on some of those pre-employment things, as well as obtaining identification, assistance on how to budget, how to build sober supports. I'm also a CCAR trained train the trainer, and we're pursuing another grant that will be building that up and educating more coaches as well. With the advent of the pandemic, we implemented a day program of recovery coaching. So individuals who would normally be kind of out looking for jobs are now assisted in-house because as we know, most of that stuff, applying for jobs, all that kind of stuff is done online now. And we are also doing our orientation assessments and via telehealth. And one of the other awesome things is that we now have a van. So we can provide transportation to all our clients who need helps with getting to doctor appointments, picking up those prescriptions, and then of course rides to and from for interviews and work. And another part of what we've built into the program is sustainability. Of course, we've secured partial funding through government and private funders, and a portion of that salaries and all the supplies are funded by state, county, private funders. And we're just so grateful to have the assistance with Hope Task Force to get us going. I'm also a grant writer. I'm constantly searching for new prospective opportunities. It's a weekly, sometimes daily effort of getting those grants in. And like I said, I'm so grateful for this opportunity.
Thank you, Holly. We're grateful for the opportunity to work with you. So we're looking forward to it. Thank you very much. I do know that we're at 10 o'clock. So Dr. Wilson, I know you were planning to say this. If you don't mind, I'm just going to jump in. If anyone does have to drop, feel free to do so. No issues with that whatsoever. Appreciate everyone joining. We're going to keep going because we do have a couple other items on the agenda. But if you need to hop off for another meeting, feel free to do so. Lastly, for the grant project updates is Carly Klubeck from the health department, who's going to give an update on the MAP program.
Okay, so I'll keep this brief because I know that we're short for time. So my name's Carly Klubeck. I supervise the substance use services as well as our forensic behavioral health programming with the health department. So specifically today, just want to highlight our MAT efforts, which launched in the summer of 2019. And as of this week, we have over 50 active MET clients in our programming, and we actually just administered our 200th Vivitrol injection, which I think is pretty amazing considering over 170 of those were administered during COVID. So the two programs that we have are one for the individuals in the community and also one in the DuPage County Correctional Center. Our community-based MAT program is available to DuPage County residents who have Medicaid, Medicare, or uninsured. We offer Vivitrol, Suboxone out of the Wheaton and our Addison locations. As part of this program, the client is also linked to treatment because we believe very strongly in the importance of the treatment in addition to the medications in order to support long-term recovery. So we really try to kind of shy away from being a prescriber-only program because we know that this is just one tool and there's so much more that goes into it. So the other program that we offer is at the DuPage County Correctional Center, where we work really closely with the sheriff's office in helping individuals who are currently incarcerated and have been struggling with opioid addiction. As we all know, we've talked about today, individuals who are extremely vulnerable when they get out of being incarcerated, they're high risk for overdose. A lot of them don't have resources lined up, and it turns into this kind of revolving door of them getting released, getting taken back into custody, continuing to use. So the goal of this MET program is to decrease that risk by assisting them in getting a jump start on the recovery prior to getting out. So the program is geared towards people who are going into the community. So individuals on probation, pretrial, people who are really at that vulnerable population and wanting to get them a Vivitrol injection prior to their release. So, we know that the cravings can be really intense and that can often deter or kind of interfere with recovery efforts. So by getting this injection prior to release and linking them to treatment, we've really seen some successful stories. We are looking at helping them with insurance reinstatement while they're in custody and figuring out what other resources they need, getting them set up to where they're kind of stepping down right into services within 48 hours of being released. So this program is open to any individual, regardless of county of residence or insurance type that they have. I just kind of want to close with just sharing a client story, because I think that all the stuff we talk about is great, but really highlighting kind of a personal story for a client can show, what amazing work can come out of this. So we had a female inmate who was struggling with opioid addiction prior to booking. She was actually identified with the help of pretrial services in the courts, and also our mental health reentry program manager that works full-time in the correctional center. This individual completed a substance use assessment while in custody with one of our clinicians and also a psychiatric evaluation with one of our prescribers. So we were able to verify that her insurance was active too, because we know that's a huge barrier to accessing treatment upon release. So she received a Vivitrol injection day prior to her release, immediately began our IOP services within 48 hours of release. And she also noted during our program that she really feels that Vivitrol made a huge difference for her this time, because in the past, she's never been able to get out and without immediately returning to use because the intense craving she would experience. And so how in the past, it would always sabotage any recovery efforts that she had, and that she was very grateful for this opportunity. So I know that a lot of us probably have different stories, and I'm not just sharing that one to, kind of highlight the great work that we're doing. But I think it's really important for us to continue to tell these stories as a reminder of how much great work is being done, but also how much work is ahead of us. I do believe that it truly takes a village, and with the help of the pretrial services, sheriff's office, court, everyone being behind this client, I really do believe that it made a huge difference. So I'm grateful to be part of this process and these opportunities. I'm really looking forward to kind of all the progressive and exciting things that are, I have no doubt that are going to continue to come in trying to address this epidemic.
Carly, can I ask you a quick question? Is there a
Sure
central number for clients that may be interested in MAT, or do we call Wheaton and Addison separately?
I would say, and I can send this out too, they can always call our main number to get linked up, but if there's someone who, if you're looking at referring them, they can always call myself, and I can kind of help expedite things a little bit, because I know with these MAT clients, time is really important, and there's a lot of urgency behind it. So if we need to kind of figure out ways to expedite things, if they're between injections or they're getting out, or getting released from residential treatment, those are all different things that I think are really important that we are mindful of. So the main number they can always call, but then they can also call, me, and I can kind of direct them where we need to go to get things set up.
And can you email that number, or is it something you just give out, or what's the best way to get it?
Sure. Yeah, here, 1 second. I can put it in here, but then also maybe Mila can
That'd be
send
great.
some stuff out
Thank
too.
you.
Jim, I'm going to have a summary of each of the programs that we just talked about and have their contact information and as much as they're willing to share in summary on the
Okay.
Hope Taskforce, or on the Hope website. So people can go right to that and see all the opportunities, and we'll put it under the treatment and recovery section.
Okay, great. Thank you.
Thank you so much, Greg, and thanks for everyone for this incredible information. There's so much work going on. I loved what Carly was saying. That was almost a good set of closing remarks there. We're not just looking at numbers, we're looking at stories where there's an individual, there's a story behind every one of these numbers. So thanks for slowing us down to do that. Mila, it was your turn. So I'm going to repeat what Greg said. If anybody has to leave, that's totally understandable, but maybe we should consider making these meetings 2 hours, since we only get together like quarterly, so because there's so much to say. But Mila, it's your turn. Tell us what
Sure,
we need to know.
Thank you, and I'll keep it brief. As I mentioned in the chat, we are coming up to a large milestone for the DuPage Narcan program. We're close to 1,000 successful saves or opioid reversals since the program started in 2014. But for the 2020 reversals, we settled at 192, and I do think we have a few more forms coming in. We've seen a little bit of a delay in reporting this past year in 2020, so that number may increase a little bit, but we'll probably stay at 200 or under. And so if you look back at 2019, in that year we had 207. So this will be the first time that we have a decrease in the number of reversals reported, successful reversals reported. And I just want to think about what Dr. Jorgensen had mentioned earlier about the increase in fatal overdoses, and we will be looking at all of the use forms that came in and really report more on this at the February 12th DuPage Narcan program annual meeting, so we'll have a little more detail to share. But the other side of the coin on these reversals is that we record every use of Narcan that participants report back. So the other side of it is that even though we had a decrease in the number of reversals that were successful, we had an increase in overall uses in the program. So it tells us that Narcan is being used more. The other thing that came across, and we did look at this in August, was that we had a number of reversals came back that pointed to benzos or Xanax pills. Many times police thought those were counterfeit, so likely they could have been fentanyl. Those were not classified as successful reversals because it was not known that they took an opioid. So, I think the program is doing really well overall. We're encouraged that Narcan is being used more, not only in the community, but also with our first responders that are within the program. We've seen really good growth in the program. We have more than 84 program participants, and our training numbers will also be reported at the annual meeting. So I think the counterfeit pill issue is something we need to talk about a little bit more. And Dr. Jorgensen, Greg, are you waving? But I think you're muted.
Talking to me or Greg Shorsey?
Greg Shorsey, I see waving.
Okay.
I wasn't sure if that was for me or not.
No, I'm sorry. I was speaking to a family member. I'm
Okay,
so sorry.
very good. I just didn't want to ignore your waving.
Thank you. Thank you.
So, getting to the counterfeit pill information that and the fentanyl information that both Andrew Anslem shared and the deaths younger side of things that Dr. Jorgensen shared, we did have several calls from poison control on cases like that. And those were in younger people. I think ages 19 to 23 was what we saw in DuPage County. So, several of those people have hooked up with the Narcan program and have Narcan in their homes. And a couple of them have refilled it several times. So this is definitely an issue for us on the younger side of things. When we started this program in 2014, we did not see a lot of IV use of heroin. We saw a lot of pill snorting and pill use, and that wasn't considered dangerous by younger people when we first started talking about this. So I think it's something we need to follow up on, and we'll look at those forms and talk with some of our partners about that and report more in April. But Illinois Poison Control has been a great partner through this counterfeit pill issue, and we'll keep working with them too. Moving to funding, we were thrilled that the state of Illinois provided us some additional funding, quite a large amount actually, of over $200,000 that had to be used for the purchase of Narcan. So we did purchase Narcan at the end of 2020 that will hold us over for quite some time. And the product that we use, Narcan nasal spray, now has a 3-year expiration date. So it's a good investment in Narcan, and funding always changes year to year. So we're encouraged to have that money and use it while we have it. So the program is stable with Narcan supply on hand. And then lastly, I just wanted to add that we have a couple of educational opportunities coming up. And they're both in February. One of them is, they're both in partnership with National Safety Council. One is pointing towards safe prescribing for all medical professionals. And the second one is specifically looking at oral surgeons and dentists and having alternate prescribing options other than opioids. And this is something that we've talked about this at Hope for a while. At the health department, we've talked about our partnerships with oral health, and that being one area where younger people may be initiating some opioid use. And this will be a great conversation to have in February. So I will send you some more specifics on the DuPage Narcan program. You'll see our information updated on the Hope website, and we'll talk more in April. Thank you.
Thank you, Mila. You're such a champion for this work. You and Chris have been great partners with this, and with Karen Ayala out there kind of being the umbrella. Thank you for what you do. Greg, do you have another 15 minutes or so, or should we wrap it up?
I'm good on time. I think, we could, again, if anyone needs to leave, that's fine with me, but, and I think with you, Lanny, too, but we can keep going if that's.
I think we need to talk, maybe the next meeting should be 2 hours. There's just so much to talk about, but I'm going to give everybody an opportunity. One of my favorite parts of this thing is this round table that we do, just to, in case there's something on your mind or heart. You've been good listeners, but maybe there's something that somebody needs to share, old news, new news, something to share. So Tim, I'm going to go ahead and start with you since you're here on my left side. I know you spoke earlier. It was so good to hear from you. Anything else that you'd like to share before we close?
Not that I can think, listening to Lauren, it really started getting me thinking about just a great obvious partnership that can exist here because we have very similar goals. Like I said, I am meeting at 11 with all my probation officers to start these discussions in earnest. So, right now, Doctor, I don't really have too much more to add from what was previously said, other than I think, we're really excited about moving forward with this initiative. So
you did a great presentation. We're thrilled that you are where you are. Greg, anything more that you'd like to add, partner?
No, I think just one thing to preview. I know One other topic that's being discussed a lot in circles regarding substance use disorder is the concept of harm reduction. I know that's something that we haven't dived into as a task force too much, but I think what we might be hoping to do at the next meeting is give a little bit more of a primer and background on the concept of harm reduction to help educate the task force. And I think that'd be a good next step. So if that works for the group, I think we can plan to add that to the agenda.
Great suggestion. I second that emotion. Carly, to your, anything else you want to add? Yours was a quick pace, but a wonderful presentation. I loved the little story you added.
I don't think anything else to add, really. Just, I think it's important to find ways to get inspired and to really help remove all the barriers that these clients have, especially during these times, because I think, we always say not to work harder than our clients, but I do believe that during this time, we do need to work harder than them. There's a lot of barriers. I mean, I think all of us are struggling at different times, related to COVID and isolation. And I can only imagine, it's like almost like a feeding ground for addiction this time is.
Yeah.
And I think we've been pushed in ways that I never thought we would be doing telehealth services and, but it's really important that I think we're the voice for this population of people who are struggling. I remember when we were told that we'll be working remotely, the first thing I said is, what about the Vivitrol injections? It's like, these are the things that we need to be on top of, because if there's a gap, we lose them, And so I think that that's just really important to echo. And we're all about finding solutions instead of finding obstacles. And we've gotten really creative. And I think it's important to have the passion to do this, because sometimes it's really challenging work. So I appreciate everyone's time and dedication and, everything that we're doing here to kind of support these individuals.
I'm so happy you're on the team. You say all the right things. That's perfect. I see Deb Lewin just is next. Deb?
Hi. So we're just really busy working on getting the RCO up and running, and I am so honored to be working with Lauren, that she has joined my team. So that's just, we've been busy just preparing and planning and creating. And Carly, I would love to connect with you as well.
Very good. Thank you, Deb. Brad's to your left.
Everyone, great meeting. And, we're definitely a hope task force. And I think that's one of the most important things that we cannot do is lose that hope. I think we're very good at keeping that alive with all the different organizations, people that we have here in this roundtable, really just striving for a solid solution. Those numbers are staggering that we heard earlier from Rich Jorgensen. Myself, I've lost a few friends since the last meeting, but I've also seen a lot of people continue in their sobriety. My buddy Jason got 10 years. My buddy Sean, he got 4 years. Another friend just entering back into sobriety with 2 weeks, totally going guns blazing, looking forward to happiness, serenity, and peace, and, putting their best foot forward. I think when the pain becomes a little too much is when this change starts to happen. I always said the opposite of addiction is connection. And what I see is the recovery community overcoming that gap when that strive is on. We're great at problem solving. But one of the cool things that I've experienced is, I got to go to a meeting out in Pittsburgh the other night, by going to Zoom. So just checking out different parts of the world too, So
yeah,
across the board, I believe that especially now that the vaccine's out, we will bounce back from this stronger than ever, especially with the hurdles that we've overcome during this time, to be able to problem solve and reach so many more people that might not have a license, that might not have the ability to go to and from treatment. Now they can Zoom in or do telecounseling. So hindsight, although we're not through it yet, I believe we're opening the doors for so much more to be able to offer the solutions, because addiction is cunning, baffling, powerful. We all know that it's very, very strong. So we need to be able to overpower that addiction. And I think through this process, we're finding a lot of necessary tools to do so. So thanks again for everybody that's on this panel and with the Hope Task Force. You guys do amazing work. It takes a village to help somebody, just one person, find recovery. And I think that's a vital part that everybody here plays.
Brad, we're thrilled that you're with us. You're the voice of one who's been there, and that is just so important. I didn't realize that Lauren shared that same experience, so her emotion was precious. Mila, do you want to add anything more?
No, but I just wanted to say that we have a lot of things on the April agenda. So one of those updates will be our BGA grants that we're doing with the correctional center. So Mike Drugan and I were talking on the side here, and we'll have an update on both the mental health and substance use programs. Carly is really familiar with that, and the work of Amy Coleman and our staff on the behavioral health MAT side will be expanded upon at the April meeting.
Speaking of the next meeting, Mila, did we decide on April the 16th or the 23rd? I don't remember.
I think it's an open question.
Okay. So stay tuned. Very good. Thank you. Bernadine, thanks for being with us today.
Sorry. Okay. Good morning. My update is just about drug court. Even with the pandemic, I think we're proud to say that our graduates increased for 2020. So I'm looking at our numbers. In 2019, we had 10 graduates, and in 2020, we had 14. So I think we're really proud that even through all these hurdles and all these barriers in 2020, that we did have an increase in successful completions of drug court. And we have definitely had, as Bob spoke to earlier, a huge increase in referrals for the program. So we're hoping that our 2021 numbers will even be more successful. And Carly is also a part of our team. So I see her nodding there.
You've got a great team over there. Bob Berlin was on, he gets interviewed so often. It's wonderful that he's committed to this process. He's such an important person in this county. So you all make a great team together. Thank you so much.
Sure, thank you.
Greg, you're next. Thanks for being with us. Greg Schwartz.
Thank you. Thank you very much for having me. It was very informative, very interesting. Obviously, I haven't been to one of your meetings before, but thank you for letting me be your guest today. I just real briefly about myself. I'm a 27-year career firefighter paramedic who has been on dozens and dozens of overdose, typically opioid overdose, and including 8 deaths that I've personally been on, including one as recent as this past Monday. So this is a committee that I find near and dear to my heart, and I will be, whether I get appointed at some point or whether I'm just a guest, I'm going to be participating, and anything you need from me or anything I can do to help would be absolutely, I'd be blessed. So thank you very much.
I can hear it in your voice. I can hear it in your story. The Edward Elmhurst commercial goes something like, "This is not just a business for us, this is personal." So I can see that that's your story. So thanks for being with us. Mike Drugan, you're next. Any final remarks?
I think his mic is still. How
Oh,
you
that's
doing,
right.
Mike?
That's right. Oh, I'm sorry. So happy you're with us. Hello to the sheriff for us. Chief Creston.
Hello, everybody. I'd like to introduce myself to Greg. Greg, welcome. I've heard a lot about you. I hope that shortly we can get together and talk about the Narcan program and make sure that we got you guys dialed in with the training. And we've done a lot with that with Mila and the Hope Taskforce to get the Narcan training out. So hopefully we can get a connection and improve that. So welcome aboard.
Thank you so much, Chief.
Again, great meeting, a lot of great information. And I'm thankful that the grants that we were able to provide the groups are helping, and they're on their way to helping those that are in need. So
Thank you. Chief Creston walks the talk. He doesn't just talk it, he walks it. Jim Scarpace, I think I missed you, didn't I?
Oh yeah, no problem though. I just want to let everyone know an update on our Downers Grove location. We're getting closer. Again, it's going to be a 3040 Finley Road, Suite 220. Furniture's in, phones are in, staff are hired. I'm hoping that we'll be able to start intensive outpatient services out of there for both Medicaid as well as unfunded and insurance clients in February. We're going to have a virtual open house sometime in the month of February. I just want to confirm that date. And once I get it, I will send a link to Mila and get that out to the task force.
Look forward to that. Thank you so much for your commitment and for being with us today. You're such an important part of this team.
Thank you.
Jason Blumenthal, Can you unmute and say hello?
Hi, I'm Jason Blumenthal. I'm the new policy and program manager for DuPage County. I'll be in and out and paying attention to what's going on as well. Very excited to be a part of the team.
We appreciate you being with us. Thank you so much. Cheryl, you want to say something, Cheryl? You're such a quiet listener. Cheryl Marquet. Can you unmute and say hello? Maybe she's not with us still. I'm going to finish up with Rich Jorgensen. Penny Chana is our communicator and does so much. Penny, how are you doing over there?
Doing just fine.
Good, good. Well, thank you for all that you do and keeping us organized, and we'll look forward to working with you in 2021.
You're very welcome.
Thank you, Penny. I'm going to finish up with Dr. Jorgensen. Your report was so important, partner. Thank you for.
Well, I just hope that 2021 is a refreshing and invigorating new year. I started 8 years ago, as you know, and there were 38 overdose deaths in that year. And the following year, there was 42 or something like that. So we've almost tripled that. And I'm just tired of, I think Jim Scarpace was talking about that Delnor had 3 deaths in a weekend. We also had 3 deaths this weekend. And it's getting to the point where it used to be shocking to me. And that's why I brought this up 8 years ago. It's getting so regular now that it's become a normal part of our life to lose young people and older people. We had 3 people in their 60s. So I just wish for all of us and for our society that we come out of this COVID lockdown and we start going back to seeing people, eating food in restaurants, and taking care of our health. So I hope that for all of us.
Thank you so much. Now, I was thrilled that you were reelected. Is it for another 4 years? Do we get to share you for that?
It is. It is. Thank you.
That's
Thank
great.
you. Yes.
Dr. Jorgensen was really the one of the first people to bring to light, not only in DuPage County, but in the nation, this problem with opioid overdose. And we're so lucky, so fortunate that he serves with us on this task force and that he oversees the coroner's office here in DuPage County.
Thank you for that.
My pleasure. We didn't finish at 10, but we're finishing at 10:30. Thank you everyone for hanging in there. And just be blessed, be safe. Thanks for all that you do. And we look forward to seeing you back again in April with hopefully some really positive news and positive reports. Keep up the good work and stay safe.
Thank you all.
Bye-bye.
Thanks, everyone.
Thanks, everybody.
Thank you.
Thank you.
Good job.